The workplace today is changing in ways that directly impact worker health and the health of businesses. Employers are looking for ways to improve the health and safety of their workers, as well as their bottom line. We need professionals who can help lead these changes in workplaces. UNC Gillings School of Global Public Health offers an online graduate certificate program in total worker health to help prepare the next generation of workplace health, safety, and well-being professionals who can help organizations create safe and healthy workplaces for all workers.
The total worker health approach takes traditional occupational safety and health programming, safety specials, industrial hygienes, and so on. It combines it with traditional workplace health promotion, where there's a lot of wellness programs, behavioral programs to help employees stay healthy. We bring those worlds together, and when we bring them together, it's a secret sauce. It's total worker health is looking at the whole individual that is situated in the whole workplace. What's really unique about total worker health is we not only focus on the worker, but we focus on what's driving worker behaviors, what's happening in the work environment, what's happening with work that will improve the safety, health, and well-being of the worker. We have a variety of different students and working professionals who are enrolled in our program. It could be anywhere from nurses, physicians, industrial hygienists, safety specialists, as well as people in exercise science, public health education, all kinds of different professions. So these individuals come together in the classroom and they bring their discipline-specific expertise, and we add the total worker health training on top. It's kind of like icing on the cake.
For Jenna Gerstner, the connection between work and health is shaped by real-world experience, working alongside firefighters in New Hanover County. That perspective led her to the Total Worker Health Certificate Program.
I decided to take classes in the Total Worker Health Certificate Program because I wanted to better understand how work and health intersect and gain the tools to improve health, safety, and well-being of workers, especially first responders like firefighters. The program gave me a framework to look beyond the individual and really consider how work conditions and organizational factors shape people's experiences.
The Total Worker Health Certificate includes 3 required courses, beginning with a foundational class, Critical Issues in Work, Worker, and Workplace Health.
In our foundations course for the certificate, you learn about how work impacts our overall health. We also learn about the key role of regulations in protecting workers' health, safety, and well-being. So we learn about the Occupational Safety and Health Administration, the Family Medical Leave Act, Americans with Disabilities Act. We also learn about the changing nature of work. So work has changed significantly in past years. We have a growing services sector. We have the rise of AI. We have the rise of gig work, and all of that impacts workers' health, safety, and well-being, and society, and we talk about that.
So when I think about the Total Worker Health Certificate, what stands out is how each course built on the other, from building knowledge to learning skills to applying them in practice. The first course showed me how work itself is a social determinant of health. I learned to look at wages, job security, policies, and culture as direct drivers of health outcomes.
You get to see firsthand different regulations, different people who work at these organizations, from OSHA, from NIOSH. So I think being able to work firsthand with these people and with these rules is by far the most valuable thing to me.
The second required course focuses on measurement and evaluation, giving students practical tools to assess worker and workplace health.
In our measurement course, students learn about how to engage workers and managers to figure out what needs to be changed at the worksite. We really start with interactive methods. For example, things like body and risk mapping, also things like interviews and focus groups, so that students can work directly with managers and workers to hear what is happening and what needs to change. Students in our measurement course also learn and build a toolkit of survey and sampling methods that they can use to understand what's going on at the worksite. We include things like the social environment. Students might learn about manager-worker relationships or safety climate. And we also talk about the physical environment, so students learn skills for air sampling, for example. And all of this goes into a comprehensive toolkit so they can prioritize what needs to be changed at the workplace. And at the end of the course, you bring everything together and learn how to communicate back with key stakeholders in the workplace, from frontline workers all the way up to the C-suite.
In the third course, students use data and evidence-based strategies to plan, implement, and evaluate total worker health interventions tailored to specific worker populations, while engaging workers at every stage.
In the interventions course, students are learning how to put everything together that they've picked up in the first 2 courses in order to design programs, policies, and practices to make the workplace safer and healthier. Students learn how to look at the evidence base in order to figure out what really works, and they learn how to work with workers and managers to tailor those solutions to a particular workplace setting. Some examples: in past classes, students have looked at pesticide safety training and thought about how to adapt those to make them more interactive and better for multiple languages. We've also had students work with home care agencies and develop policies around leave for home care workers who need to grieve the loss of patients.
Together, these courses give students more than knowledge. They gain practical skills, real-world experience, and the confidence to lead change in complex work environments.
What's been most helpful in my career is that total worker health is a systems-based approach, and all the practical skills I learned from using this approach. It helped me think about interventions not just at the individual level, but also at the organizational and policy levels, which is critical in my work today.
One of the biggest benefits of the Total Worker Health Certificate is that it doesn't just teach theory. It gives you a structured framework you can carry into any workplace. For me, the certificate was a bridge between my corporate background and my public health training. It validated what I'd seen in the workplace, that culture, job design, and leadership matter deeply for health, but it gave me the scientific tools to address those issues in a rigorous way.
In all honesty, the most influential part of the program has been my peers. My peers in the Total Worker Health tend to have more life experience, more experience working with real communities in real industries than my academic peers in engineering tracks do. They tend to be a little bit older and they tend to come from really interesting places. They tend to be working on really interesting projects. So the opportunity to work on group projects or to hear their perspectives on different issues, just kind of the real life experience that gets brought into the Total Worker Health classrooms is really deep, and that's really been an honor to be part of.
My expertise so far is limited to agriculture. I was really excited about this program because it would expand my expertise to other areas, other industries. And so this program has given me some tools so that I can adapt interventions for different workers at similar risks to farm workers, like maybe construction, those that work outdoors.
For faculty, one of the most rewarding parts of teaching in the Total Worker Health Certificate program is learning alongside the students.
I enjoy getting to meet all sorts of really talented professionals from many different disciplines. Every guest lecturer is an opportunity to learn something that I don't know from my own training. I really enjoy learning from all of our students. Many of our students already come with professional work history in this area and bring great case examples, or perhaps they bring something that they're currently in the work site. They're currently working with farm workers, they're currently working with hospital workers, and they want to understand how to make positive changes. And so this training is part of their road to do that.
Total worker health is a new field, and that makes it really exciting. It's only probably a 10, 15-year field. People who are in the workforce now are eager to learn ways to really help their employees have a safe and healthy work environment. So the individuals who get our training are in a position to add value to the organization and really step up and lead that change that creates a great place to work.
If you are a student or working professional who aspires to improve the well-being of tomorrow's workforce, whether by leading organizational change, doing practice-based work, or conducting applied research, the UNC Gillings Graduate Certificate in Total Worker Health can support your next step.
To learn more, you can visit our website, where you can download course details and application information. And you can also email us directly. We're here to help you start your journey.